Assalamualaikum Warahmatullahi Wabarakatuh. Hello guys. Introduce, my name is Restiana Agusti from the Pharmacy Study Program batch 2021. Here I will present the result of my work and detail the spread of the coronavirus in Indonesia. Watch the following my video. Spread of coronavirus SARS-CoV-2 cases Covid-19 in Indonesia. Definition of coronavirus SARS-CoV-2. Acute respiratory syndrome coronavirus 2 SARS-CoV-2, or better known as the coronavirus, is a new type of coronavirus that is transmitted to humans. This virus can attack anyone from the elderly, older people, adults, children, and infants to pregnant women and breastfeeding mothers. Coronavirus infection called Covid-19. Coronavirus disease 2019 was first discovered in the city of Wuhan, China at the end of December 2019. This virus spread very quickly and spread out to almost all countries, including Indonesia, in just a few months. This has prompted several countries to impose lockdown policies to prevent the coronavirus from spreading. In Indonesia, through government implement a policy of enforcement and community activity restriction to suppress the spread of this virus. Coronavirus is a collection of viruses that infect the respiratory system. In most cases, this virus causes only mild respiratory infections, such as the flu. However, this virus can also cause severe respiratory infection, such as lung infection, pneumonia. In addition to the SARS-CoV-2 virus or coronavirus, viruses that are included in the coronavirus group are the virus that causes severe acute respiratory syndrome, SARS, and the virus that causes Middle East respiratory syndrome, MERS. Table of content. Number 1, coronavirus symptoms and casus COVID-19. Number 2, diagnosis and treatment of coronavirus COVID-19. Number 3, complication and prevention of coronavirus COVID-19. And last, foreign grip of coronavirus in Indonesia. Point 1, coronavirus symptoms and casus COVID-19. Symptoms of coronavirus COVID-19. Early symptoms of coronavirus infection or COVID-19 can resemble flu symptoms, namely fever, runny nose, dry cough, sore throat, and headache. After that, the symptoms may disappear and heal or even get worse. Patients with COVID-19 with severe symptoms may experience high fever, cough with pain, uneven blood, shortness of breath, or chest pain. These complaints arise when the body reacts to the coronavirus. In general, there are 3 general symptoms that can indicate a person is infected with the coronavirus, namely fever, body temperature above 38 degrees Celsius, dry cough, hard to breathe. There are several other symptoms that can also appear in coronavirus infection, although it is less common, namely diarrhea, headache, conjunctivity, loss of ability to taste, loss of ability to smell, anosmia, rashes on the skin. The symptoms of COVID-19 generally appear within 2 days to 2 weeks after the patient is exposed to the coronavirus. Some patients infected with the coronavirus can experience a decrease in oxygen without any symptoms. This condition is called hypoxia of coronavirus COVID-19. Coronavirus infection or COVID-19 is caused by coronavirus, which is a group of viruses that infect the respiratory system. In the vast majority of cases, the coronavirus only causes mild to moderate respiratory infection, such as the flu. However, this virus can also cause severe respiratory infection, such as pneumonia, middle is respiratory syndrome, and SARS severe acute respiratory syndrome. A person can get COVID-19 various ways, namely accidentally inhale the droplets that come out when a person with COVID-19 coughs or sneezes, holding your mouth or nose without washing your hands first after touching an object that has been splashed by the saliva of COVID-19 survivor. Make close contact with people with COVID-19. Coronavirus can also be transmitted through objects that are often touched, such as money, knobs, or table surface. The coronavirus can infect anyone, but the effect will be more dangerous if it occurs in elderly people, pregnant women, people who have certain diseases, smokers, or people with immune system are weak, for example, in cancer patients, because it is easily transmitted. The coronavirus is also a high risk of infecting medical personnel who treat COVID-19 patients. Therefore, medical personnel and people who are in frequent contact with COVID-19 patients need to use personal protective equipment. Window diagnosis and treatment of coronavirus COVID-19. Coronavirus COVID-19 diagnosis to determine whether the patient is infected with the coronavirus, the doctor will ask the patient's symptoms. Furthermore, to confirm the diagnosis, the doctor will perform the following examination. The test to detect antibodies, IgM and IgG, produced by the body against the coronavirus. Rapid antigen test to detect antigen, which is a protein on the outside of the virus. Swab test or PCR, polymers chain reaction test to detect the coronavirus in the lining of the nose. CT scan or chest X-ray to detect infiltrates or fluid in the lungs. Compact blood count to check the level of white blood cell and C-reactive protein. A positive COVID-19 rapid test result most likely indicate that you have indeed been infected with the coronavirus, but it could also mean that you are infected with other germs or virus. On the other hand, a negative COVID-19 rapid test result does not necessarily indicate that you are absolutely free from the coronavirus. Coronavirus COVID-19 treatment. In patients with mild or asymptomatic symptoms, doctor will recommend self-isolation at home, while taking steps to prevent the spread of coronavirus infection, Some action that doctor can take care refer patient with severe symptoms for treatment and quarantine at the referral hospital. Prescribing refer and reliefs that are safe and appropriate to the patient condition. Advise patient to self-isolate and get adequate rest. Encourage patient to drink lots of water to maintain body fluid levels. Meanwhile, in patients with severe symptoms, the doctor will provide a referral to undergo quarantine at the referral hospital. Treatment methods that can be given include infusion of fluid to stay hydrated, installation of a ventilator or breathing apparatus, medication such as blood thinner, and anti-inflammatories, anti-interleukin 6, IL-6, remdesivir or favipiravir. Point 3. Complication and prevention of coronavirus COVID-19. Complication of coronavirus COVID-19. In severe cases, coronavirus infection can the following complication: pneumonia, lung infection, secondary infection of other organs, kidney failure, acute cardiac injury, acute respiratory distress syndrome, death. In addition, there is also the term long haul COVID-19. This term refers to someone who has been declared through a negative PCR test result but still has complaints such as weakness, cough, joint pain, chest pain, difficulty concentrating, palpitation, or fever that comes and goes. Prevention of coronavirus COVID-19. COVID-19 vaccination and stable immunity against the coronavirus. In addition, vaccination also aims to form herd immunity. That way, people who cannot get the vaccine because they have certain conditions such as severe allergy, reaction to the vaccine can be protected. Vaccination is the best way to prevent COVID-19 factors that can cause infection with the coronavirus, namely apply physical distancing, use a mask when doing activities in public places or crowd, routinely wash hands with water and soap or hand sanitizer containing at least 60% alcohol, especially after activities outside the home or in public places. Do not touch your eyes, mouth, and nose before washing your hands. Increase endurance by leading a healthy lifestyle. Avoid contact with people with COVID-19. Cover your mouth and nose with a tissue when you cough or sneeze. Then throw the tissue in the trash. Keep the environment and home clean, including objects that are frequently touched. For the people suspect of having COVID-19, including suspect and probable categories, firstly referred to as people under monitoring or patient under surveillance. There are several steps that can be taken to prevent spreading coronavirus to others, namely to self-isolation by staying apart from other people for a while. If this is not possible, use a bedroom and bathroom that is different form that used by other people. Do not leave the house except to get treatment. Call the hospital to pick you up if your symptoms get worse. Forbid other people to visit you until you are fully healed. As much as possible, avoid meeting people who are sick. Avoid sharing the use of eating and drinking utensils, toiletries, and sleeping equipment with other people. Wear a mask and gloves when in public or with other people. Use a tissue to cover your mouth and nose when you cough or sneeze, then immediately throw the tissue in the trash. Last point, grave of coronavirus in Indonesia. The grave of stage that on May 2002 there were 107 new cases and 18 people who had died. The graph also states that the highest number of cases reached 50 to 60,000 cases, and the number of deaths due to Covid-19 in Indonesia reached 2,000 people. Well, that's all I can say about the spread of the coronavirus. If there are wrong words in the presentation, I apologize. Thank you. Wassalamualaikum warahmatullahi wabarakatuh. See you.